So Carina, thank you very much for being willing to do another video.
Absolutely.
We're going to move into the topic of what can we do to help with making this any better whatsoever. So
this is what everyone's waiting to hear.
Right, that's what everybody needs to know, the stuff that we didn't know. Are there sort of day-to-day, I'm just going to start very simple, are there day-to-day things that we can do, like changes in diet, supplements, vitamins, things that won't require us to go to a doctor that could help us with our symptoms?
Sure. I think it's important to think about what can help with symptoms that can also help with our general long-term health. And it's the same stuff that we hear about most of our lives, that we want to be eating a healthy, well-rounded plant-based diet or Mediterranean diet seems to be the best approaches to diet in general. Maintaining a healthy weight is really important through perimenopause and menopause, as is getting adequate exercise. And by adequate, I don't mean you need to be out there training for a marathon.
Good,
though please, if you want to, go for it. However, even something as simple and relatively easy as a 20 to 30 minute walk every day, or if that's too long a chunk of period to take out of your day, a 10-minute walk 2 or 3 times a day will make a tremendous difference, both with symptoms and with your overall health.
What about supplements, food?
Supplements, food or?
Like food that we can eat that would help, or supplements, whatever.
As far as supplements are concerned, I think that's very individual. If you're talking about nutrients like vitamins, generally it's better to get nutrients through the diet. Our body likes those better. Our bodies absorb nutrients better through food than through supplements. But in the case of, for example, someone who's not getting enough of a particular nutrient in their diet, and I'm thinking calcium and vitamin D, because many people are not consuming dairy right now, that it can be challenging to get enough calcium and vitamin D outside of dairy products. So sometimes those supplements are very important, primarily for long-term health, but can also help to some degree with symptoms. If we're talking about herbal supplements or homeopathic supplements, there's not a tremendous amount of scientific data about these things, and unfortunately here in the US, because they are not regulated by any agency, like the FDA regulates our over-the-counter and prescription medications, that you just have to be cautious with the products that you're getting. There's a lot right now being marketed to very desperate perimenopausal and menopausal women, and I can understand that desperation, but be cautious about what you're getting. Well, there is not a lot of data behind all of the supplements that are out there. There is some data about the usefulness in things such as black cohosh for some menopausal symptoms. Ashwagandha, which is an adaptogen, can help with mood regulation. Vitex or chaste tree berry can help with menstrual cycle regulation, and turmeric or curcumin, the active component of turmeric, can help with overall inflammation. So use it wisely and make sure you know what you're getting.
So moving on to the topic, hormone replacement therapy. When I was a kid, my mom had a full hysterectomy and she was on Premarin, but by the time I got to be a teenager or an adult, like, you did not do hormone replacement therapy. It was dangerous. So let's start by talking about what it is. What is hormone replacement therapy?
Sure. So hormone therapy is basically, we want to give you back the estrogen that your body isn't making anymore. And estrogen is thought to be generally safe. A primary concern with using estrogen in a woman who still has a uterus is that estrogen used alone could increase the risk of uterine cancer. Now, for that reason, for anyone who's taking estrogen and still has a uterus, we give progesterone. Progesterone takes care of that risk associated with the estrogen, and so as long as they're used together, the risk of uterine cancer is reduced back to what it would be in someone who's not using hormone therapy at all.
Okay, cool. So it's generally progesterone and estrogen. How do you get that? Do you take a pill? Is there a patch? What does it look like?
There are many different ways. There are, and the beauty of this is that we can really customize it to each person, because estrogen and progesterone are available in a variety of forms and a variety of dosages. So for example, if we're not getting adequate response or adequate symptom relief, we can increase the estrogen a little bit. If we're getting too much bleeding, we could decrease the estrogen, increase the progesterone. So there are a variety of products out there, and I like to tell my patients that whatever we're starting with is not the be-all, end-all of hormone therapy. If we're not getting optimal results, or if we're getting side effects that aren't working, then we tweak it. But your question was, how do we get this into our body? So there are transdermal forms of estrogen available in the form of a patch or a gel that is applied to the skin. There's an oral estrogen pill. There's also the progesterone is most typically administered through an oral pill, but is found in combination with some of the estrogen patches. So there are many different forms, and the best form depends to some degree on medical conditions, but also on personal preference. What's going to work for you the best medically is going to be the one that you're going to use.
True. So you mentioned bleeding as a side effect. What are some of the other side effects that you might want to look out for or be aware of?
Sure. We can see side effects, especially in the first few months of a hormone therapy use, or whenever there's an adjustment in the dosage or form of hormone that we're using. And those side effects are most commonly, and don't happen very often, but irregular bleeding, bloating, and breast tenderness.
Okay. All right. So we're talking about things that we can do to help. What are some things we could do that would hurt? This may be retreading some territory we've already talked about, but I want to make the point that there are things that you can stop doing that'll help you. So what are those?
Obviously, if there are triggers if there are things that trigger menopausal hot flashes, then avoiding them as much as possible would help. Having a sedentary lifestyle is not going to help symptoms or long-term health. Consuming more than a moderate amount of alcohol could be harmful, not only in that it could increase symptoms, but we do know that a moderate to excessive amount of alcohol consumption has a significant impact on increasing the risk of breast cancer.
Oh, wow. Okay. All right. Well, I think we've done a good job. There's probably more information to know, but that is a really good primer. We're going to move into our next video where we'll talk about what happens after this. We know about the symptoms that happen in perimenopause and menopause, but the hormonal changes last with us for the rest of our lives. How do we live a life that is flourishing and as healthy as possible into old age?